بسم الله الرحمن الرحيم وبه نستعين. Assalamu alaikum everybody. Today's presentation is a continuation of what we have started a few weeks ago about drug treatment of hypertension. Today we will speak about a very important group of drugs which are the calcium channel blockers. So the main goal of this presentation is to know first what are the physiological functions of calcium ions in general, especially on the contraction of smooth muscles, of the blood vessels, and cardiac muscles. We are going to discuss as well what are the types of calcium channels, what are the consequences of their blocking in arterioles and myocyte. Then we talk about the types of calcium channel blockers, what are their major actions and clinical applications. Calcium is involved in many body functions. For example, calcium is involved in bone formation, and in this respect, we'll talk about it, inshallah, when we talk about the endocrine system and how calcium homeostasis is controlled by the endocrine system. Now, it is generally believed that calcium ions act as a second messenger. Why? Because they are responsible for the production of many intracellular actions. These include muscle contraction, whatever the muscle is, whether it is smooth muscle, cardiac muscle, or skeletal muscle. All these type of muscles, the contraction depends completely on the presence of calcium. Also, calcium is involved in the process of neurotransmitter release or what's known as exocytosis. Calcium is also involved in the excretion from glands, whether they are exocrine glands, like salivary glands, like sweat gland, etc., or endocrine glands, like pituitary gland, etc. Also, calcium is very important for the function of many intracellular enzymes, where they are known as calcium-dependent enzymes. Usually they are protein kinases, and calcium usually results in the activation or inactivation of these cellular enzymes. It depends. So that's why calcium is considered to be as a second messenger because it is involved in many intracellular functions, including muscle contraction, exocytosis, gland excretion, and activation of intra or inhibition of intracellular enzymes. Okay, so these are the most important things we should remember about calcium ions. Calcium usually it enters or exits the cell through specific calcium channels. They are known as calcium channels. So there are specific proteins which are present either on the cell membrane or they are present in the endoplasmic or sarcoplasmic reticulum. So what are the types of calcium channels? Calcium channels generally they are of two types. The first is known as voltage-gated calcium channel. Voltage-gated calcium channel. They are usually a membrane channel which are present on the cell membrane. They are protein, of course, in nature, and they allow the entrance of calcium according to change in membrane polarization. That's why they are known as voltage-gated calcium channels. So voltage-gated calcium channels, they are channels which are present on the cell wall or on the plasma membrane, and they are opened according to the change in the membrane potential. Okay, so that's why they are known as voltage-gated calcium channel. Okay, this is the first type. The second type, they are known as ligand-gated calcium channel. Ligand, that means there are certain receptors to which a drug agonist binds to, and this binding of the agonist to these receptors will result in opening of calcium channels. That's why they are known as ligand-gated calcium channels. Maybe the most important famous example is the inositol triphosphate receptors, which are present on the endoplasmic reticulum and on the sarcoplasmic reticulum of the muscles, or the smooth muscles or the striated muscle. Okay. Also, there are other types of receptors like raynaud's receptors, which are present as well on the endoplasmic or sarcoplasmic reticulum of the muscle. Okay. So these are the types of calcium channel. Calcium channels are either voltage gated, usually these are membrane channels which are present in plasma membrane. Upon the change of the membrane excitability, these channels will either close or open. Opening of these channels will cause rushing of calcium from extracellular space to the intracellular space. Or they might be ligand gated. Usually these are intracellular calcium channels which are present on the endoplasmic reticulum or sarcoplasmic reticulum. Okay, so these are the most important facts that we should remember about the physiology of calcium ions, that they are considered as second messenger. The calcium ions are considered a second messenger, and there are of different types according to their position. So, what is the calcium ion function in cardiac muscle? Calcium ions are involved in all activity of the heart. For example, as we know that the heart activity starts at the sinoatrial node, which is known as SA node. This sinoatrial node, as we know, it is the pacemaker of the heart. It has a self-depolarization activity or automaticity. This will initiate the pulse of the heart, and this activity will spread through specific conduction systems in the heart, passing through AV node, through atrioventricular node, through the bundle of His or Purkinje fibers towards the ventricular muscle. So there are three functions of the heart. The first is the initiation of the heart pulse, which is done through the SA node. Second is the conduction of the pulse from the atria to the ventricles, which is done through the AV node. This is conduction. And third is the contraction of the myocyte or the contraction of the cardiac muscle, and this is done through the all myocytes of the heart, arterial or ventricular. Okay, all these three functions, rate and conduction and contraction, are calcium dependent. As we have taken in physiology, phase zero of the action potential of the SA node depends on the opening of calcium channel. So calcium will enter and this will initiate depolarization of SA node and initiation of the pulse. Okay, that's that's why. Therefore, if calcium is decreased, that means rate will be decreased. If calcium is increased, that means rate will be increased. This is the first. So calcium is important for the initiation of the pulse in the SA node. A second, the conduction through the AV node as well is a calcium dependent. Calcium dependent. That's why if we decrease the calcium, the AV node, conduction rate through the AV node will be decreased. Okay. Third, the contraction of the myocyte is dependent as well on calcium, as we will see in a few minutes, and therefore decreasing in calcium in the cardiac muscles will result in decrease in the force of contraction. So these are the most important things that we should remember about calcium ions and cardiac muscles. Initiation of the pulse, conduction of the pulse, and contraction of the muscles are all calcium dependent. Okay? The same thing happens with the smooth muscles of the blood vessel. As we have said before many times, that calcium is important for the contraction of the smooth muscle. We have said before that calcium ions can be either intracellular, like which present in the sarcoplasmic reticulum or endoplasmic reticulum, or they might be membrane present on the membrane. So what will happen? As we have explained many times before, suppose this is the smooth muscle cell. Once the agonist binds to the receptor, it will activate certain types of G protein, and this will lead to formation of second messenger IB3. Once the IB3 binds to the receptor, it will lead to opening of calcium channel, and calcium will exit from the inside the reticulum into the cytoplasm. Once inside the cytoplasm, calcium will activate other protein kinases as we have described before, okay, resulting in muscle contraction. The same thing, there are calcium channels on the cell membrane, calcium channel on the cell membrane, act, change in the polarity of the membrane will result in opening of calcium channel. Calcium will rush into the cytoplasm, and once calcium intracellular is increased, it will stimulate further release of calcium from the sarcoplasmic reticulum, increasing the intracellular calcium. Okay. Now this is in the smooth muscle. So can smooth muscle cytoplasmic calcium can result either from stimulation of certain type of receptor like the beta 1 receptor, or it can stimulate by changing in the membrane potential of the cell membrane. Okay, so what will happen if you block the calcium channel either on the smooth muscles of the blood vessels or on the cardiac myocyte? In this case, if we block the calcium channel on the smooth muscle of blood vessels, of course, you block calcium channel, there is no calcium, and therefore the peripheral resistance will be decreased. Decreased peripheral resistance because the peripheral arterioles, smooth muscle will be relaxed, and this will result in decrease in peripheral resistance. As we have explained many times before, blood pressure depends on two factors. Blood pressure, as we have said, equals the peripheral resistance multiplied by cardiac output. Okay. So now in this case, if we decrease the peripheral resistance, what will happen to the blood pressure? Blood pressure will be decreased. Blood pressure will be decreased. Once blood pressure be decreased, that means that calcium channel blocker can be used in treatment of hypertension. Can be used in treatment of hypertension. They are used as antihypertensive. So this is the first very important clinical application. By blocking calcium channel on the vascular smooth muscle, peripheral resistance will decrease. Once the peripheral resistance will be decreased, this will decrease the blood pressure, and that's why they are used as antihypertensive drugs. Okay, so this is the first clinical application. By decreasing the peripheral resistance, we decrease the afterload. We decrease the afterload. If the afterload is decreased, that means the heart will work against lower resistance. The heart will work against lower resistance because the afterload is the resistance in the arterioles. If the arterioles are dilated, that means the heart will work against lower peripheral resistance. Lower peripheral resistance means decreasing the work of the heart. Decreasing the work of the heart. If we decrease the work of the heart, that means we will decrease the oxygen demand because the heart will work less. Once the heart will work less, that means it needs less oxygen demand. As we explained before, there is a balance between the demand of the heart muscles and the supply. Okay? By decreasing the work of the heart, we decrease the oxygen demand of the heart. These have a clinical application as we will see later. Okay, so this is a result of decrease in peripheral resistance. The decrease in peripheral resistance will decrease the blood pressure, and by decreasing the blood pressure, calcium channel blockers they have very important application in treatment of hypertension. Second, by decreasing the peripheral resistance, that means the afterload to the heart will be decreased. That means the heart will work against lower resistance and its work will be decreased. Decreasing the work means less oxygen demand needed by the heart. These have important clinical application in ischemic heart disease, as we will see in minutes. Okay. The second, dilatation. If the coronary arteries are dilated, that means the blood supply to the heart will be increased. Coronary arteries, as we know, they are the arteries which supplies the myocardium by oxygen or by blood. So by coronary dilatation, if the smooth muscles of coronary arteries are relaxed, that means coronary blood flow will be increased. Coronary blood flow will be increased. That means will increase the oxygen supply to the heart. Oxygen supply to the heart will be increased. This, as you will see in minutes, as I said, a very important consequence in ischemic heart disease. Okay, so this is the two effects: inhibition of vascular smooth muscle contraction by blocking the calcium channel will decrease the peripheral resistance and will increase coronary blood flow. That's why they have very important decreasing the blood pressure, decreasing the afterload, leads to decreasing oxygen demand, increasing coronary blood flow will increase the oxygen supply. So this is on the vascular smooth muscle. On the vascular smooth muscle, what will happen to the cardiac muscles? Cardiac muscles. So if we block the calcium channels on the cardiac tissues in general, what will happen? As we said, the cardiac function is initiation of the pulse through SA node, conduction of the pulse through AV node and Purkinje fiber, and contraction of the muscles in the myocyte, whether they are arterial or ventricular. So what will happen in this case? If we block the calcium channel, we'll block rate, will block the SA node, means that we'll decrease the rate and we will decrease contraction. And because we said the rate in SA node depends on calcium, and the contraction of cardiac muscle depends on calcium. In this case, we block the rate and contraction will be decreased. This case, what will happen to the work of the heart? If we decrease the rate, we decrease the contraction, means the work of the heart will be less because the rate is slower and the contraction is less. That means oxygen demand will be decreased. Decrease the work, that means decreasing the oxygen demand by the heart tissue. Okay, so this is first. By decreasing the rate and decreasing contraction, force of contraction of the cardiac muscle, the heart will work less, decreasing the work of the heart. If the heart works less, that means it needs less oxygen demand. Okay, so now calcium channel blocker by decreasing the oxygen demand through the action on the heart and by increasing the oxygen supply by an action through coronary arteries and by decreasing the work of the heart, decreasing the oxygen demand by decreasing the afterload. All these three are the mechanisms responsible for their use in ischemic heart disease. In ischemic heart disease, especially angina pectoris, especially angina pectoris. Therefore, we'll expect that calcium channel blockers are used in treatment of angina, different types of angina, as we will see later, inshallah, when we talk about drug treatment of ischemic heart diseases. We will talk again about how calcium channel blockers are used and what type of angina. Okay, so by decreasing the oxygen demand through decreasing the afterload and decreasing the oxygen supply through the coronary vasodilatation, and by decreasing the oxygen demand by decreasing the rate and contraction, these drugs they have very important clinical application in treatment of different types of angina pectoris. Okay. A second function of the heart, as we have said, is the conduction. Is the conduction. So by inhibiting, when conduction is defected, as we have said before, when there is a conduction defect, this will lead to what's known as cardiac arrhythmia, or loss of cardiac rhythm, cardiac, known as cardiac arrhythmia. That's why calcium channel blockers are used in treatment of certain types of arterial arrhythmia, especially arterial arrhythmia, where there is an increase in the excitement of SA node or increase in its automaticity, and as well a defect in the conduction through AV node. So this is the third application of calcium channel blockers that are used for treatment of cardiac arrhythmia. Okay, so there are three major uses of calcium channel blockers that are used as antihypertensive. This is the topic of our presentation, and they are used in treatment of ischemic heart disease. We'll talk about that in details, inshallah, when we talk about ischemic heart disease, and they are used as antiarrhythmic. Okay, so these are the general action which can take place on the cardiovascular system and the cardiac muscles by calcium channel blockers. So what are the calcium channel blockers? There are generally what are the types? What are the types of calcium channel blocker classification? Generally, there are two types of calcium channel blockers. First class is known as dihydropyridines. Dihydropyridines. These are very important group of drugs and contains very famous examples like nifedipine. Nifedipine. Nifedipine is known commercially as Adalat. There is isradipine, philodipine, nicaridipine, etc. All these are dihydropyridines. A second group, they are known as the non-dihydropyridines. None. They are not structurally, they are not related to the first group. They are known as non-dihydropyridines. These groups, famous examples like verapamil and diltiazem. Verapamil and diltiazem. So we have two groups as calcium channel blocker. First known as dihydropyridines, second known as non-dihydropyridines. Dihydropyridines prototype is nifedipine, when non-dihydropyridines prototype is verapamil, مشهور. How they differ, these two groups, how they differ from each other? First, the different mechanism of action. At first, dihydropyridines usually they block calcium channels which are present on the blood vessels. They block a calcium channel which are present on blood vessels. Okay, so therefore these drugs they decrease the peripheral resistance or they decrease the afterload. So mostly this is they have very little effect on the calcium channels of the heart. Okay, so this is the first group, dihydropyridines. They block the calcium channels which are present in blood vessels. Therefore, they will decrease the peripheral resistance and they will decrease the afterload. The second group is the opposite. Mostly they block the calcium channels on the heart. Okay, verapamil like drugs, they block the calcium channel in the heart, and they have little effect on other calcium channels of the blood vessel. So we expect what will happen. The first group, they produce vasodilatation. They decrease dihydropyridines. They decrease the peripheral resistance. Therefore, they will decrease blood pressure. That's why they can produce hypotension. They can produce hypotension. This is very common side effects with these drugs, especially at the very beginning of the treatment. Because they decrease the peripheral resistance, usually this will result in what's known as reflex tachycardia, as we have explained before. Any decrease in blood pressure will stimulate the baroreceptor reflex, and this will result in reflex tachycardia. This will be felt by the patient as palpitation, This is very common side effect with these drugs. So if the patient is complaining of palpitation, this is a common side effect. Also, they produce edema especially of the ankles and or known as ankle edema. This effect is not known why. There is no known mechanism of action, but it is very common side effects of these drugs. Also, they produce flushing of the face, and this flushing of the face is common. Why? Because they produce vasodilatation of the smooth muscles of the blood vessels of the face. So they produce flushing of the face. Okay, these are very common action produced by dihydropyridines like drugs, and they are mostly side effects. The other non-hydropyridines, on the other hand, they produce bradycardia because, as we have said, they act on the heart, so they decrease the heart rate. This is okay, except when there is a cardiac block or there is a heart failure. Also, they can produce hypotension because they will decrease the cardiac output. Also produce constipation. Why? Because they block the calcium channels on the intestinal smooth muscle. This is very common side effects with the non-hydropyridines. They can produce constipation, okay? They produce constipation, very common side effects. So if the patient is complaining of constipation after the start of the treatment, then it is due to the side effect of verapamil-like drugs, okay? So what's the difference between their clinical uses? Clinical uses, as we have said, dihydropyridine, the decreases peripheral resistance and the decreases afterload. Therefore, they are very important use in treatment of hypertension. They are very, they are first line treatment, as we will see, inshallah, next week in the treatment of hypertension. So uh, nifedipine-like drugs, they are first-line treatment of hypertension. Why? Because they produce dilatation of the arterioles, they decrease the peripheral resistance, and therefore they are potent inhibitor of blood pressure, they decrease the blood pressure. Also, they are used in treatment of chronic stable angina. Chronic stable angina. We'll discuss the mechanisms, how they do that, inshallah, when we talk about the treatment of angina pectoris. Also, they are used in treatment of Raynaud's disease, which is usually due to vasoconstriction of peripheral blood vessels in the hands and the legs. Nifedipine-like drugs, they are effective in alleviating the symptoms of Raynaud's disease. Okay, so this is about the dihydropyridines uses. They have very important clinical use in treatment of hypertension, chronic stable angina, and Raynaud's disease. السكند جروب اللي هم الفيرابامين like drugs or non-hydropyridines, they have very important clinical use in treatment of hypertension as well. As we have said, they decrease the cardiac output and they decrease blood pressure. Also, they are used for treatment of chronic stable angina, and we will explain that inshallah in details when we talk about treatment of ischemic heart disease. Also, they are used in treatment of certain types of arrhythmia, especially atrial arrhythmia, and we'll talk about it in details later, inshallah. Sometimes they are used for a reduction of proteinuria in certain cases of renal failure. So these are the major differences between the different types of calcium channel blockers. Some of them they block specifically calcium channels on the blood vessels, and the most famous prototype is nifedipine. And nifedipine most common clinical use in treatment of hypertension and كذلك في chronic stable angina. We'll talk about it later, inshallah. The other verapamil-like drugs, they prefer blocking calcium channels on cardiac tissues, and therefore they have very important clinical implication in treatment of hypertension, chronic stable angina, and cardiac arrhythmia. Okay, so these are generally what uh, the general principles about calcium channel blockers. So in summary, we have talked that calcium is important for the contraction of vascular smooth muscles and the cardiac function, and we expect therefore, that by blocking calcium channels, this would decrease peripheral resistance. That's why they are used as antihypertensive. They will decrease the afterload and increase the coronary blood flow and work of the heart. That's why they are used in certain types of angina vectors. They can decrease excitability and conduction in the heart tissue, and therefore that's why they are used as antiarrhythmic. We have said that the hydropyridines usually they are antihypertensive. The dihydropyridines اللي هم nifedipine-like drugs they are used as antihypertensive, while the non-dihydropyridines اللي هو verapamil-like drugs they are used as antihypertensive in certain types of ischemic heart disease and antiarrhythmic. Okay, so this is what we have talked about. Next lecture, inshallah, we'll talk about the last group of drugs which are used in treatment of hypertension, and we'll talk, inshallah, about the different lines of treatment of hypertension. I would like to thank you very much for your attention. If you like my presentation, don't forget to press like. Please subscribe to my channel. Don't forget to share with friends. Wish you all the best luck. والسلام عليكم ورحمة الله وبركاته.